Late Night Health moves forward. I'm Mark Alyn. Our guest from SP of Southern California, that Standard Process of Southern California, Cindy Ferdinand. She's the Director of Clinical Nutrition, along with Greg Curtis, the President of the company. When we're talking right now about symptoms, somebody goes to a doctor and says, "Doc, it hurts when I do this, and I use this," and the doc says, "Don't do that." To me, the new question it's an oldie but goodie that people laugh every time I say it. But what I'm telling people is, when the doc says don't do it, I suggest to people that they say, "But doc, why does it hurt when I do that?" And I think that's
a good question.
I really think that's really the basis of the way SB products are presented to patients and clients. Would you agree with that? In other words, you go in and you say, "I'm sneezing. Every morning I sneeze. I'm allergic to something." That's just the result of a potential condition. And so,
Cindy, why don't you take that as a practitioner?
Yeah, I think Mark, what you're trying to say is, a symptom is a symptom. If somebody is having a histamine effect because of allergies, you could throw some vitamin C at it, and it will reduce that histamine effect. But what's Standard Process? And I'm going to speak on behalf of practitioners and all the healthcare practitioners and doctors out there that work with Standard Process. Health is such an important thing, being vital and healthy. We don't want to just get at symptoms. Certainly, we empathize, and we want to have somebody symptom-free. But what supplements and Standard Process's whole food ingredient supplements get at is more of the root cause. It's sort of like, let's get underneath it. Let's get inquisitive. Let's open enough doors to figure out what might be causing it, and then support the entire system, the entire body, right? So it's not just trying to get at one thing. It's trying to do the underlying foundation of support. So supplementation, like you were talking about earlier, I think it's in the 70-some% now of people who are actually taking supplements. But do they know why they're taking it or what they're taking? And that's really important for healthcare practitioners to be really supporting their clients, their patients with, is what do you actually need based on your own individual biochemistry? And are you taking something off the shelf, like you had mentioned earlier, that may be sitting there for some time, or are you taking a whole food supplement that is really actually food, feeding your body? So eating properly, taking the right supplements, getting the exercise you need supports vital health. And it's super important that you get to the underlying cause. So I think one of the things we talk about, and Greg, you may jump in because I know he's passionate about this as I am, and it's talked about everywhere in the industry, is inflammation, right? The underlying cause of so many degenerative diseases is inflammation.
And we just talked about that last week here on Late Night Health.
Oh, you did?
Oh, absolutely. Inflammation. And understand, I have to back up here a second. I am not a healthcare professional. I am what am I? I'm a proactive healthcare consumer advocate, suggesting to people how they can interact with doctors, nurses, chiropractors, and other healthcare professionals, and what to expect. So that's what I do.
And so you're teaching people, right? You're teaching people to be proactive in their own health. That's what I'm hearing you say.
Yeah,
right?
Well, it's that old, Doc, why does it hurt? I want to know why it hurts. Not
really getting underneath it.
Getting underneath it. It would seem to me that's the model that SP has practiced for 90 years.
Well, here's the thing. It all starts with nutritional deficiencies. I know that sounds like a simplistic approach, but that's actually what it is. Sometimes we overthink things, and it is a nutritional deficiency that starts with farming. Starts with the fact that the food that we're being presented with Even if you're trying to eat clean, whatever that definition is for you, organic, the nutrient density is not there in the same way it was 20, 40, 60, 80 years ago. So you start having inherent nutritional deficiencies. And then, Mark, you were talking about the traffic today. We live in a very stressful world, right? So just your daily commute, right? What does that take out of you? How does that affect your digestion, right? We all talked about as little kids, you are what you eat. But in reality, the next part of that is you are what you eat, but you are what you digest, right? You need to break down those proteins, fats, and carbohydrates to get the nutrients and the minerals and the vitamins, right? Especially those minerals. So how is our daily life and the food that we eat affecting, our health and our ability to do the things that we want to do, the quality of our life, to excel in our job, to spend time with our family and friends? So, Cindy was talking about inflammation. It's these things that cause, that can take, a small injury perhaps from acute inflammation where the body's healing itself to a chronic long-term inflammatory condition. And again,
like overdrive.
Fed. Yeah, exactly. And then it's just fed by this nutritional deficiency. So when you're taking a supplement, so when you come to a standard process practitioner like Cindy, she's going to do a very thorough intake for you because she wants to find out what's causing these nutritional deficiencies. And Royal Lee was all about having the patient go to a practitioner, chiropractor, acupuncturist, nutritionist, MD, whatever, so that practitioner could do what they do for a living, adjust, needle, etc. Right? Mm-hmm. But then there's also a second leg of that stool, which is identify those lifestyle issues and those dietary issues that are helping to cause or continue those nutritional deficiencies. And then the last part of it is you create a therapeutic protocol with standard process and our MediHerb phytoherbal line in order to, support those nutritional gaps as you see the practitioner, as you change your diet and lifestyle, as Cindy said, as you get more active. And those three things together are that workable therapeutic protocol to address. It's not just adding years to your life; it's adding life to those years, right?
That's I like that I like that. That's a great line. Greg, you've mentioned several times SP standard process practitioners. My understanding, and please correct me if I'm right or wrong, is that to get one of your supplements, it's recommended to you by a healthcare practitioner of one kind or another, a DC, a DO, an MD, a nurse,
an
ND, yes,
nutritionist,
massage therapist. I mean, all of these people are healthcare practitioners in one kind or another. So rather than I'm sorry, go ahead.
No, finish. I'm sorry. I didn't
that was it. That was my statement. Am I correct?
Yes, absolutely. And Royal Lee was a strong believer in the patient-practitioner bond, that patient-practitioner relationship. And throughout the course of our 89, almost 90 years, we have maintained that, and we stress that. And the reason why is this. You could have a symptom of something, and if somebody just bought off the shelf or self-diagnosed, they may not know what the underlying reason is. You and I may have the same type of issue. We may have allergies, or we may have leg cramps, or we may have something, but the causes of that, the underlying deficiency may be different. So if we self-diagnose, we may take something, number one, the product is not all it's cracked up to be, and number two, it is not the right product. It's not going to fill our nutritional gap. So then we take it, and it doesn't work, and then we throw the baby out with the bathwater because it didn't work, where it was operator error in the first place. So
but at the same time, and Cindy, join in on this one. A lot of times you take a supplement because it makes you feel good taking it rather than affecting a symptom. For example, brain cognition, heart, even blood pressure, supplementation, all of these, you may not see a result. You just know that you're doing something good for your body and for yourself. Can you respond to that?
Yeah, and I think that this is a really, really important topic, and I'm glad we're bringing it up. And I usually say something like this. Most people will go to the shelf and pick up a supplement because Aunt Susie told them to take it or their friend told them to take it. They have no real understanding of what they need, why they need it, their own individual biochemistry. No assessment has been done. And so this process that Standard Process so believes in being vertically integrated from the plant to the patient and having a practitioner involved in that assessment allows that patient, that client, whoever they are, to have somebody helping them decide what it is they particularly need and get underneath why they need it versus just going out and taking a bunch of different products and potentially doing harm or getting more than you need of something. That's another important thing about Standard Process is that it's a whole food complex. It's not 5,000 milligrams of ascorbic acid. It's a vitamin C complex in the whole food. So it's really a distinction that I think takes some explaining, and really I think more education needs to be done in that respect so that people are not just taking a bunch of products recommended by somebody and maybe not even really know that they need it.
Right. And at the same time, there are some things that we in America are not taking enough of, like vitamin D. For years now, for years and years and years, we stay out of the sun. We block the sun with sunscreens.
We don't drink milk. A lot of people are lactose intolerant.
Here I am, and you don't want to be around me then, and especially with a shake. Can't. Anyway, vitamin D, there's a big shortage, and not a shortage of vitamin D, but it's just not. We don't have enough levels in our blood, and we're being told, hey, spend time out in the sun and supplement. Is this something that we should go to a practitioner, get a blood test? There are blood tests online now that you can do for vitamin D levels and omega-3 levels too.
Yeah, I think that that's the whole point that Standard Process has had in practice for 80 years plus is to get the recommendations from a healthcare practitioner and get the testing, like blood work. We can assume we have a vitamin D deficiency, but much better to actually have that test done to show that we have it. Are we taking what we actually need? Is there a need for it? So that's based on an individual assessment, and that's what all of our healthcare practitioners are out there working so diligently for, is to support one individual at a time based on their...
Cindy, we're going to take a time out. We'll come back to you and Greg in just a moment. That's the music that says we have to go for a break. We'll be back as we wrap up this hour of Late Night Health with the people from Standard Process of Southern California.
You're listening to Late Night Health with Mark Alyn. The show continues in a moment.
Welcome to Guide to the Soul. This is Robert Clancy. Balance in life isn't about making everything equal. It's about sharing equal parts of your heart for each area of your life. Many people seem to struggle with bringing their life into balance. Family, work, and health all seem to be a challenge these days. Think of the demands you have on your own schedule and time. It can be frustrating and overwhelming. What's most important to discover is that peace is not about finding a quiet place among the chaos. Peace is about listening for the divine whispers of love amidst this turmoil. Take a breath and you will find balance.
For more inspiration from Robert Clancy, visit GuideToTheSoul.com or go to the Moments with Robert page on LateNightHealth.com.
If you or someone you love suffers from drug addiction, now is the time to utilize your private health insurance PPO plan. If eligible, receive up to $30,000 or more in substance abuse benefits with low or no out-of-pocket cost. We are the National Treatment Network, the premier drug and alcohol treatment referral service operating 24/7. We help connect you with facilities nationwide that accepts PPO private health insurance for substance abuse. If you have PPO substance abuse coverage and you need immediate admittance to a medical detox or residential rehab treatment center, call us now. Call our live referral helpline today. The call is free. This program is not available to Medicare or Medicaid customers.
Call 800-296-1252. 800-296-1252. 800-296-1252. That's 800-296-1252.